Hi, welcome to What's Happening at Tri-City Medical Center. I'm your host, John Bonosoro, for this series made in collaboration with KOCT, North County's channel, and Tri-City Medical Center. Our goal is to keep you informed about health issues, events, and services at your local medical center, and to provide you with information for a healthy lifestyle. With us today is Dr. David Cohen, a cardiac electrophysiologist at Tri-City Medical Center, specializing in treating heart rhythm disorders, also known as arrhythmias. He joined Cardiac Arrhythmia Associates in 2015, directly from George Washington University School of Medicine. He practices at Tri-City Medical Center in Oceanside. Welcome to the show, Dr. Cohen.
Thank you for having me.
I'd like to start with what exactly is the field of cardiac electrophysiology?
So cardiac electrophysiology is a subspecialty of general cardiology. So all electrophysiologists are trained in general cardiology and fellowship, and then do subspecialty training for about 2 years to learn in non-invasive and invasive modalities to treat the whole gamut of arrhythmias. Electrophysiologists in layman's term would be more like the electrician of the heart, whereas interventional cardiologists would call themselves the plumbers. So we deal with electrical anomalies in the heart and improve patients' quality of life, and in some instances even save lives.
So you guys can be identified by your tool belts?
Pretty much, yeah.
Okay. So what's the nature of the work?
So we see patients that are referred to us from typically general cardiologists. So they've come down the pipeline of their primary care physician or an inpatient hospitalist to a general cardiologist, and then they've deemed either by their own diagnoses an arrhythmia, and then they'll come and see the subspecialist, in other words, the electrophysiologist. And at that point, we can either treat them with medications or more invasive modalities such as device therapy and minimally invasive ablation therapy for arrhythmias.
Later in the show, we're going to get into that in some level of detail. How frequently are people referred? Are we at the point where you almost always end up with a specialist like yourself?
Not necessarily. General cardiologists do have the training in their own tool belt to be able to treat patients medically, at least until they have symptoms or signs of arrhythmia that needs to have more aggressive therapy. However, these days there's more awareness of the field of electrophysiology. Our technologies have gotten better and safer, and I think it's more reasonable for patients on the onset of arrhythmia symptoms or the diagnosis to seek the help of a specialist sooner than later, so they can get the full benefit of the new therapies that are available.
Is the decision solely within the purview of the doctor, or would a patient have some indication as to which direction they should head?
I think that it's not unreasonable for a patient to self-refer themselves to an electrophysiologist, especially in a place like San Diego, where there are plenty of options to seek out a doctor of my specialty. I think it's more difficult if you're in an area that is understaffed or it doesn't have the availability to a specialist. But typically it's up to the general doctor to make that decision whether to seek the subspecialist. Just like if you would see your primary care physician for what you thought was like a thyroid issue, and if they felt like it truly was a thyroid issue, then they would refer you to an endocrinologist. Kind of similar to in our field too.
I understand that arrhythmias fall into categories.
Yes, so the most common types of arrhythmias are either bradycardia arrhythmias, brady being slow, cardia being heart, so slow heartbeats, and then tachycardia arrhythmias or tachyarrhythmias, tachy being fast heartbeats. And then regarding the tachyarrhythmias, you can select them into two different groups. So arrhythmias in the upper chambers of the heart, which are the atria, and the atria are the reservoir chambers where blood flows from the systemic and pulmonary circulation, so the veins in the legs and elsewhere in the body or the lungs, and then they settle in the atria before they flow into the ventricles, which are the pumping chambers. So atrial arrhythmias are typically the ones that aren't malignant or life-threatening, but they can increase the risk of issues such as stroke or passing out or a poor lifestyle, versus the arrhythmias down in the lower chambers, which are the ventricular arrhythmias. Those are your more dangerous arrhythmias. Those are the ones that can cause sudden death, and those are the ones that are more common in patients who have other structural heart disease problems, such as heart failure or coronary disease or disease due to heart blockages.
You know, the use of the word sudden death gives me you get the little flutter there.
I could see that, yeah.
Yeah. Are the symptoms different for each one of those categories?
Yes, the symptoms can overlap. Typically, if you bradycardia symptoms involve not having enough blood flow to the body and the brain. So typical symptoms of brady or slow heartbeats are fatigue, difficulty breathing, feeling dizzy, feeling like you're going to pass out. These are all symptoms of brady arrhythmias or a slow heartbeat. Fast heartbeats can overlap with slow heartbeats too, because if you think about it, if the heart is beating fast enough, you're not getting enough cardiac output or forward blood flow. So you can have this very similar symptoms to slow heartbeats, but typically patients can also feel chest pain if their heart's going too fast. They can feel anxious, and sometimes patients feel nothing at all. They have very nebulous symptoms, and those patients can be difficult to treat because it's difficult to even diagnose them until they present with other symptoms of the arrhythmia that more the result of the arrhythmia itself, whether it be a stroke or heart failure, or when we're specifically talking about atrial fibrillation.
In general, is the nature of this disease one where if you already have pronounced symptoms, it's too late or later than you'd like?
Not necessarily. Most of what we deal with as electrophysiologists, fortunately, is very treatable and reversible. So there are a subset of arrhythmias that are even curable, and we can get into that more. But typically, there isn't a time where we won't be able to offer a patient anything. And usually the symptoms of arrhythmia, the onset is early enough where we can offer something in terms of therapy.
We've got about a minute left in this segment. Can we address causes briefly?
Sure. So causes of arrhythmia are kind of subset into two etiologies or causes. One would be genetic, so something you're born with. Those are usually the arrhythmias that are curable, and then we can go into that. The other arrhythmias are due to lifestyle choices or other coexisting diseases. So high blood pressure, diabetes, obstructive sleep apnea, obesity, these can increase your predisposition to arrhythmias in the upper chambers of the heart, the atria. The more dangerous arrhythmias, they can also be due to a genetic predisposition or what's called idiopathic, that we don't know what caused them. So in a normal, healthy patient, they could have a dangerous arrhythmia. But more commonly, the dangerous arrhythmias are due to heart failure and having a prior heart attack that sets the patient up for a dangerous arrhythmia. Other reversible causes of arrhythmia are alcohol, drug use, and stimulant use.
Dr. Cohen, thanks for great information. I know we've done some good today.
Thank you.
And thank you for watching. If you want further information on electrophysiology at Tri-City Medical Center, please visit tricitymed.org. Thanks for joining us on another episode of What's Happening at Tri-City Medical Center. To watch this or previous episodes, visit our video on demand page at KOCT.org. We'll see you next time.